It's a Sunday evening, which means it's time for that weekend special show called The Dawns of Bengaluru.
The Dawns of Bengaluru. The Dawns of Bengaluru.
My name, of course, is Dr Prasad and you're listening to Fever 104 FM, the Bop of Bollywood. But on Sunday evenings from now all the way up till 8 o'clock, we shift focus away from Bollywood and music and we bring the focus onto issues and institutions and people and things that you and I need to talk about and know about. And nothing that we talk about is more important than cancer. And since the coming Saturday is World Cancer Day, our guest today is a senior consultant medical oncologist at Sidecare Cancer Hospital. His name is Dr. Prasad Narayan, and we're going to start with you, doctor, to explain to us what exactly is cancer.
Cancer is an abnormal proliferation of cells in the body. All the cells in the body are tuned to multiply and grow, and at some point of time, there are certain checkpoints which make sure that they don't multiply abnormally. Cancer occurs in a situation where the cells either gain the ability not to die and they can keep on multiplying, or they lose the ability to die.
Can this happen in any part of the body, or is this restricted to only certain organs?
Cancer can happen in any part of the body.
You mean even nose or eyes, ears?
Yeah, it can happen to any part of the body from head to toe.
That sounds scary, but the good news is that it doesn't have to be that way. We're going to come back and Dr. Prasad is going to tell us 3 big myths about cancer that we didn't know, and he's going to burst them for us up next. Coming Saturday is World Cancer Day, which is why we're talking about cancer on The Dawns of Bengaluru.
The Dawns of Bengaluru. The Dawns of Bengaluru.
My name is Dr. Prasad. This is Fever 104 FM, the Bop of Bollywood, and our guest today on The Dawns of Bengaluru is Dr. Prasad Narayan. He's the senior consultant medical oncologist at Sidecare Cancer Hospital, and he's just explained to us that cancer is the proliferation of any cells. Am I more or less right, Doc?
That's correct.
Now, you also told me very specifically that there are certain myths about cancer that you'd like to burst so that people don't approach this illness or disease with so much fear.
Absolutely. Whenever we speak about cancer, there are so many things which come to our mind. So if I say that the 3 most common myths which people have about cancer, number 1 will be that cancer happens only in smokers. So many people feel that if they don't smoke, the chance of them getting cancer is very less. It also has got another problem that when a non-smoker develops cancer, sometimes it can create problems in the family. They say that he might have spoken, he or she might have spoken without knowing, but that is not true. So maybe around 30 to 40% of the cancers which occur in non-smokers, and the reason for that could be varied. It could be a genetic susceptibility to develop cancer. It could be a environmental smoke exposure. It could just be the fact that the person is obese, and also because of some dietary choices.
We'll come back and talk about lifestyle, food and cancer.
Sure.
Are there any other myths about cancer that you wanted to burst?
So, next myth is, once you hear the word cancer, nobody wants to hear about cancer. Whenever we speak about cancer, we say the fight against cancer, these are the warriors who have come out. And that is because commonly people believe that once there is cancer, it means death. That is not true. Cancer is curable. It is one of those rare diseases, rare chronic diseases where a cure is possible. A large majority of the patients who are diagnosed with cancer get cured of the disease without needing any continuous treatment. I mean, you don't cure a diabetes or hypertension or cardiac illness. You are continuously on medications. But a large majority of cancer patients, once they are treated for a finite time period, they come back to life and they don't need any further treatment.
And you had another point to make about what the treatment is like.
Absolutely. The third myth which I would like to say is that once you speak about cancer, it's about pain. The treatment of cancer is so painful. People feel that once you start treatment for cancer, you become bed-bound. You are not able to work. All those are wrong actually. All the therapies which are used in cancer, which include surgery, radiotherapy, chemotherapy, hormonal therapy or targeted therapy, they are very safe. And most of the patients, I can say that a majority of the patients who take treatment for cancer continue working. Children go to schools. People who are working continue to work. And it doesn't affect your quality of life in a big way.
Well, that's good news. But we haven't spoken about something that has come up repeatedly in the research and from our listeners, which is the role of cell phones and Wi-Fi and cancer. We're going to talk about that next. Does the use of cell phones cause cancer?
The Dons of Bengaluru. The Dons of Bengaluru.
That's what we're going to ask our guest today on the Dons of Bengaluru. My name is Darius Sonawala. This is Fever 104 FM, the Bap of Bollywood. We've got World Cancer Day approaching this Saturday, which is why we're talking about cancer with a senior consultant, medical oncologist at Site Care Cancer Hospital. Dr Prasad Narayan has just explained to us three big myths about cancer: that it is curable, that the treatment is not as painful as it's made out to be, and of course that even if you're not a smoker, you need to be careful. And we're going to come back, doctor, and talk about lifestyle and food and that role in cancer. But I've got a question that's coming from one of our listeners, Vani. She wants to know, do cell phones and Wi-Fi cause cancer?
Yeah, I think that's a very important question. And to answer in one line, I think I'll say the jury is not out. There is no direct proof to say that using cell phone can cause cancer. Having said that, I mean, it's definitely a high risk to always be under the effect of radiation. So it is always better to use cell phones with a Bluetooth or speaker. Keep cell phones away from children. And even if you are using cell phones when children are around, better use it with a speaker phone. Because definitely we don't want to have any kind of exposure. Too much of anything is bad. That's what we realize with time. And maybe in a course of time we will realize what is the actual risk and which cancers are related to either cell phone exposure or even exposure to other kinds of radiation and Wi-Fi zones. But it's always better to be decreasing any kind of exposure.
Your answer has got me worried as a parent myself, because your answer sounds scarily similar to the answers that was given about cigarettes and smoking before it was clearly proven, that they said that you can't prove it for sure. And isn't that one of the problems with carcinogens, that it's very difficult to prove absolute correlation between an activity and cancer?
Absolutely. It is even more complex in terms of cell phones, because cigarette smoking we can actually know that we can titrate the amount of carcinogens which an exposure is there. For cell phones, you don't even know what is happening around you. With the present era, when you are all with the Wi-Fi and hotspots, and there is no place where there is no radiation which is happening. So, I mean, it is difficult to say that, but I am sure that there will be a way to find it out, and there are many studies which are looking into it. But to find a direct cause, to say the truth, we don't have a direct evidence to prove.
This is just not the answer I was hoping to hear, doctor. It really, I was hoping for an answer that says absolutely not. It doesn't, but this is a scary answer. We've got a lot more information about cancer coming up on the Dons of Bengaluru with me, Darius Sonawala, so stay tuned to Fever 104 FM, the Bap of Bollywood. The coming Saturday is World Cancer Day, which is why we're talking to a senior consultant medical oncologist at Site Care Cancer Hospital. Our guest on the Dons of Bengaluru is Dr Prasad Narayan.
The Dons of Bengaluru. The Dons of Bengaluru.
My name is Darius Sonawala, and I was so surprised with his answer to the question just before this. We had a listener called Vani who wanted to know whether cell phone use causes cancer. And according to our guest, Dr Narayanan, he says that the jury's out. We don't know yet. There's no proof that it does, but also there's no absolute proof that it doesn't, which is kind of scary. And we're going to come back and talk about some scary aspects to cancer. But first, doctor, why do we need a World Cancer Day? Feb 4th is World Cancer Day, and it seems like every 2 or 3 months there's something about cancer that's coming up in the media.
Absolutely. So, as a medical oncologist who treats cancer patients, I think the three most important allies of cancer are fear, ignorance and complacency. So there was a World Summit Against Cancer for the new millennium, which was held in 2000 in Paris, and that day was 4th February. So the decision to go ahead with a World Cancer Day was to allow researchers, health professionals, patients, common people, government, industry, media to fight against these three allies of cancer. So the main objective of having a World Cancer Day is just to have awareness. There should be the name cancer. People should know that there is something called cancer. Only when you know about cancer, we think what it is, whether I am at a risk for cancer or anybody else is at a risk for cancer, what can we do together as an individual and as a society to get on top of this disease.
And I like the fact that we unnecessarily fear things that we don't know. And if we don't know about it, then we get complacent about it. And I think, if you're not a smoker, there's a certain kind of complacency that sets in. I don't smoke, there's no chance of cancer. But that's not true, is it, doctor?
Absolutely.
Yeah, we'll come back and find out how your food and lifestyle might be putting you at risk without you even realizing. Up next on the Dawns of Bengaluru. Feb 4th, the coming Saturday, is World Cancer Day, and we're talking about cancer awareness on the Dawns of Bengaluru this evening.
The Dawns of Bengaluru. The Dawns of Bengaluru.
My name is Dr Nawala, and if you've just tuned in, you're halfway through my weekend special show called The Dawns of Bengaluru. We've got another hour to go, and we're chatting with the Senior Consultant Medical Oncologist at Sitecare Cancer Hospital. Dr Prasad Narayan has been telling us some very interesting and surprising things about the history behind World Cancer Day, about how cell phone use might or might not cause cancer. We don't know for sure absolutely right now. And I've got another question for you, sir, that's just come in from Richard. We mentioned earlier that you've conducted over 200 stem cell transplants, and I know that stem cell is a core passion and expertise for you. Richard wants to know, is it worthwhile to save the umbilical cord blood? Actually, first we need to explain what exactly is umbilical cord blood.
This is a very important question, and I think everybody should know about stem cells. So stem cells are mother cells. A stem cell can actually multiply and it can form any other cell in the body. So there are different sources of stem cells. One of them, and a very good source, is umbilical cord blood. So what happens usually was that the umbilical cord used to be cut and the blood used to be wasted. But the discovery that umbilical cord is a huge source of stem cells has actually made a huge impact, not only in the treatment of cancer, in the treatment of many other illnesses where stem cells are used. Having said that, the question specifically was, what is the use of preserving umbilical cord blood? So we should consider that this is a service to the society, not for personal use. The chance that umbilical cord is going to be used for your own family members is maybe 10 to the power of -5 or -6.
Wow, that's a very low chance.
Absolutely. But the chance that we are contributing to society is huge, because India being our population is very high. There is a possibility that if we preserve all the umbilical cord stem cells in our country, we might find a stem cell match for us from the country itself. And that is the way forward.
When you say a stem cell match, you're saying that my own cord blood might not be of value to me, but if I match myself with someone else and we have a pool of collection, is that how it works?
No, it's not like that actually. The requirement for yourself might not happen in your life, but that does not mean that this stem cell will be wasted. If we can have a stem cell registry where wherever the umbilical cord stem cells or even other stem cell registries are matched, and India develops a kind of stem cell registry, whatever we have preserved might come handy to somebody else. Also, we can contribute to some kind of stem cell research which is happening in a big way all across the world, including India.
I hope that answers your question for you, Richard. If you want to save the umbilical cord blood, do it as a service to society more than trying to ensure your child or your family's safety in the future. Let's come back and talk about Sitecare Cancer Hospital. We haven't even spoken about this hospital. I know it's recently launched. We'll come back and talk about that next. You're listening to Fever 104 FM, the Bop of Bollywood. My name is Dr Nawala, and this is my weekend special show called The Dawns of Bengaluru.
The Dawns of Bengaluru. The Dawns of Bengaluru.
We're almost at the end of the show. We've got just maybe 2 or 3 questions left, and we're talking to Dr Prasad Narayan. He's the senior consultant. He's a medical oncologist at the Sitecare Cancer Hospital. And we're talking to him because the coming weekend, this Saturday, is going to be World Cancer Day. And, we've spoken about cancer, we've spoken about you, but we haven't spoken about the hospital. How is Sitecare Cancer Hospital different? Because it's just launched. How old is the hospital?
It's 2 months old now.
And how is it different from other hospitals?
It's a very good question. So, Sitecare Cancer Hospital, you can say it's a dream come true for many of us who have working together there now. It's a 150-bedded hospital, and we have decided to be providing site-specific oncology, which means that we have a specific team for each type of cancer which can happen. How does it help actually? Because cancer is a complex disease. And it is not about the individual, it's about the team. So there's a multidisciplinary team which decides what is best for a particular patient at a particular point of time whenever the patient comes to our hospital. So we have a patient-centric approach, and the entire hospital has been designed to give the best of experience to the patient, and we are going to make a difference by treating cancer the right way.
What do you mean by the right way? It implies that someone is treating cancer the wrong way.
I don't want to say that, but we are going to treat cancer in the right way.
All right. You mentioned that cancer is a very complex illness, disease or illness.
It can be. It's a disease. Yeah.
You mentioned that cancer is a very complex disease, and I think we need to focus on that. We never really spoke about the interaction between food, lifestyle, and cancer. It's not just smokers who are at risk. You could be at risk with certain activities in your life that you don't even realize you're doing. We'll come back and talk about that specifically up next on the Dawns of Bengaluru. Food, lifestyle, and cancer. That's what we're going to talk about now.
The Dawns of Bengaluru. The Dawns of Bengaluru.
My name is Dr Nawala, and on the Dawns of Bengaluru, our guest today is Dr Prasad Narayanan. He's the senior consultant. He's a medical oncologist at Sidecare Cancer Hospital. He's just spoken to us how Sidecare Cancer Hospital, which has been launched about 2 months ago, has dedicated itself to treating cancer correctly. And of course, it's state of the art and all that. But you mentioned in the course of that explanation, doctor, you said that it's a complex illness. There's a crazy interaction between our food, our lifestyle, and cancer. Could you elaborate on that a little bit?
Yeah. I mean, whenever we talk about healthy lifestyle, we always think about cardiac health. And as it is known now, in India, the second most common cause of death after cardiac illness is cancer. It is just not because of smoking or tobacco related. The most neglected part of it is the lifestyle related cancers which can happen. So just by having a healthy lifestyle, we can actually prevent many cancers. Like, it is very clearly documented that many cancers, including colon cancer, breast cancer in postmenopausal women, endometrial cancer, are directly related to obesity and lack of exercise. A very interesting study which just published recently was done in patients who have advanced colon cancer, in which they just randomized patients into two groups. One group did 30 minutes of regular exercise, and both the groups got the same treatment. The people who did exercise had a 20% more benefit.
Wow.
And 20% more benefit in advanced cancer is a huge difference actually. Even big therapeutic interventions can't bring about such difference. So those things are very important. We should convey this to the society. So exercise not only helps us preventing the occurrence of many cancers, being active while you are a cancer patient actually helps you get on top of the disease in a bigger way.
You also mentioned diet.
Right. So the right diet always helps. It not only helps in making you feel good and prevents many other illnesses, it also prevents cancer. So a low fat, low calorie, high fiber, and diet rich in fruits and vegetables and antioxidants actually help.
It's great to have you tell us all of this, and I want to just remind the listeners that the coming Saturday is World Cancer Day. Feb 4th is World Cancer Day, which is why we're talking about cancer. There's a lot of information available online as well. There are a lot of events to build awareness about cancer. Make sure you participate and educate yourself on what activities put you in the high-risk categories and what activities reduce your chance of cancer. We've got very little time left. One last question for you coming up next, Doctor. You're listening to Fever 104 FM, the Bop of Bollywood. My name is Dr Nawala, and this is my weekend special show called The Dawns of Bengaluru.
The Dawns of Bengaluru. The Dawns of Bengaluru.
If you've just tuned into the show, then you've tuned in at the very end of a very interesting discussion with Dr. Prasad Narayanan. He's a senior consultant. He's the medical oncologist at Sidecare Cancer Hospital. We've been talking to him because the coming Saturday, Feb 4th, is World Cancer Day. And we've spoken about how cell phones and Wi-Fi might or might not cause cancer. We're not yet absolutely sure. We've spoken about the history of world cancer. We've spoken about why we need to save umbilical cord blood, whether it's good for you or society. We've spoken about activities that put you in high risk. We've spoken about things that you can do, like exercise, that reduces the chance of cancer. It's been very enlightening speaking to you, Doctor, and thank you for your time. But before you leave, is there a message that you'd like to share with the city?
Bangalore has been selected as the most dynamic city in the world. We are all proud about that. But we want to strive to make Bangalore the most green, clean and healthy city in the world.
Which will also help us have healthier lifestyles and less chance of cancer.
Absolutely.
Thank you so much for your message, Doctor. Thank you so much for your time.
Thanks a lot.
It's a Sunday evening, which means it's time for that weekend special show called The Dawns of Bengaluru.
The Dawns of Bengaluru. The Dawns of Bengaluru.
My name, of course, is Dr Prasad and you're listening to Fever 104 FM, the Bop of Bollywood, but on Sunday evenings from now all the way.